It's a story you'll see only on NBC 26. When it comes to mental health care, the need has never been greater. Mental health experts are working hard to address the issue, and now state leaders are getting involved. NBC 26's Alex Hagan continues our two-part series on mental illness with the ongoing effort to provide much-needed care.
We've addressed the ongoing issues, a shortage of psychiatrists, longer wait times, and the stigma of mental health. Well, the effort is ongoing to reverse this trend with new legislation involved.
One in four of us is dealing with the challenges.
It's clear when those challenges result in lives lost, something needs to be done. The Trestle Trail shooting can provide that example.
People who need help aren't getting help, and we need to do something about that.
Beth Clay at the Northeast Wisconsin Mental Health Connection is working tirelessly to reduce stigma, provide that care, prevent crisis situations.
We're learning now how to all row in the same direction.
Clay's focus is on getting everyone working together when it comes to mental health, and it starts with a number of initiatives.
We have one on 24/7 crisis response because that's been a real challenge. Where do people go when they're in mental health crisis?
Another looks at children's mental health.
And ideally get to them before they're at a point of crisis.
Lisa Kogan-Praska at Catalpa Health, formed in 2012, is making a difference.
We've served about 17,000 kids, so that's been just a huge impact on access.
Catalpa is working with a number of school districts in the Fox Valley, but there is always more work to do.
And I think there's more that we can do to help support families with really complex mental health needs so that we can provide more wraparound care and support to make sure that they have the resources that they need as well.
Provide more services, reduce the stigma, get people the help that they need.
Now our state leaders are getting involved in the fight with new legislation. Representative Mike Rohrcast of Neenah is supporting a number of bills aimed at providing more mental health care. He says there are reimbursement issues for psychiatric services.
So we're actually looking at legislation on a pilot basis that may help that. So in other words, we would be giving a primary care physician that is dealing with a mental health issue with one of their regular patients some extra expertise through the reimbursement rate system.
We don't address this issue right now. We're going to continue to have major disasters on our hands.
Representative Paul Tittle of Manitowoc is the chair of the Mental Health Committee in Madison. One of his major concerns is the psychiatrist shortage in the state.
There's actually 16 counties in northern Wisconsin that don't even have a single psychiatrist that would service that county.
New legislation would provide an incentive for psychiatrists to move to Wisconsin. So there are efforts going on, but right now the challenge remains on getting people to seek mental health.
Encouraging people to get over this issue of stigma.
It's critical on so many levels.
People like Clay and everyone involved in this fight continue to reach out because it is a problem that can't be ignored.
We're losing people at a rate that is just unforgivable. And we use the zero suicide philosophy because there's no number that is okay besides zero.
That is a lofty goal, but if we keep spreading awareness on the need for treatment, just maybe we can make a difference. Now, another bill circulating in Madison is one that will allow behavioral health experts to come into schools and conduct therapy sessions. I'm Alex Hagan with NBC 26.
And to find out more about legislation circulating in Madison, just head to our website, NBC26.com, and click on this story.